I was experiencing pain in the right shoulder up into my neck. I'd seen Dr. Newton before for some hip issues and thought he was the man to see. Dr. Newton took several x-rays, subsequently an MRI, and announced that I had a torn rotator cuff.
The most common way to tear a rotator cuff is really as we age, because of the blood supply and part of the rotator cuff is not very good, then it tends to tear.
I was concerned about my athletic endeavors with golf and swimming and the activities that I like to take part in. It caused me not to sleep very well or be comfortable in any one position for a period of time.
It's a very common complaint of a rotator cuff tear is basically having pain at night that tends to wake them up and or they can't sleep on that side. The first thing you do is get a good physical exam. It's very important to get a good physical exam and history to see how they may have injured it, because you want to pick out if they injured it in a specific trauma or a lifting type episode, because it matters a lot on what you decide to do as an orthopedic surgeon.
Dr. Newton suggested that surgery was in fact the solution, that it would not heal itself and the pain would not subside. The discomfort would not subside. It was a very easy election.
The rotator cuff surgery is something that can be done either arthroscopically or through a mini open type procedure. The way I decide to do it has a lot to do with the type of tear, how big the tear is, and the patient. If we decide to do it through the scope, the incisions are obviously much smaller, but that would require, in my opinion, a smaller type tear that wouldn't require multiple anchors, multiple sutures like in a large to massive tear.
Dr. Newton made it very clear that with each patient and each surgery it could be slightly different. He was very optimistic that it was a routine procedure and that I would be pleased with the outcome, which I was. It's been 8 months. I feel fairly unlimited at this moment in time. I feel that I'm on my way to being 100%.